What are some components that make surgery so successful for you?
I would like to think that it's skill, but I know better. Biggest part is having a plan and having actually several plans because the first plan could very easily fail and you need to go to plan B. So basically, having a plan is the first thing. Second thing is making sure that the patient is actually is the patient has got to be emotionally and mentally there and ready to go and have the surgery. If they're not, it's not going to work out. And that goes back into that social aspect. You got to make sure that the patient is going to be safe when they have surgery, both in your care, obviously, but more so when they leave your care and they're going home. And I'm actually a big fan of rehab, okay, post-operative and pre-operative rehab, which then works right up to the physical therapy aspect, which is if I have somebody that I know I'm doing a big reconstruction on, and I have it scheduled, 2 months from now, or 3 months from now, or 6 weeks from now, if I can, and time and space allow, I like to get them in to see physical therapy beforehand for two reasons. One, uh, physical therapy can then kind of develop a relationship with the patient so that there's no loss from before the surgery, during the surgery, after the surgery. You don't lose the patient in the shuffle, and the patient already kind of knows what to expect both from the surgery and from the post-operative rehab standpoint. And also, if you're able to get them in to see the physical therapist before surgery, you can do prehabilitation. So you get the patient prepared because the stronger they are before they go into surgery, the better off they're going to be during surgery, the quicker they're going to recover after surgery. It's an integral part of the equation. I have never been one to kind of cut and run, to kind of let the patient go as soon as I'm finished. It's a marriage, and so the most successful parts of the surgery is making sure that just like a marriage, there's good communication and owning up to your mistakes and owning up to anything that needs to be done afterwards. So there's this kind of constant feedback loop, and you know, having everybody on the same page is extremely important. Whether it is, the hospitalist, the physical therapist, the social worker, um, all these people work with the surgeon and with the patient to make sure that the surgery is as successful as it